It was our goal to create an environment where the patient's experience is unmatched. We want patients to feel like they're in the right place. Clearly it's the people that make this practice, and I think from the moment they walk in and see the space, they're greeted by people that have the same philosophy that we have, which is that we care about these patients. We want them to be treated well. We want them to be delivered the highest quality of care from the moment they walk in, and in a friendly atmosphere, in a professional atmosphere. We have a lot of experience, and most importantly, we have the desire to treat people the way we would want to be treated or have our families treated. And that's really what built my practice from the very beginning. And now I can do it in an environment that is state of the art. Ultimately, when patients are looking for the surgeon that's going to take care of them, as it relates to cosmetic surgery, the highest level of training comes from certification by the American Board of Plastic Surgery. I think that patients should be looking for that. I trained at MD Anderson Cancer Center in Houston. I brought some of the techniques for skin-sparing mastectomy here to the Valley. I've settled into a practice where people identify with my results and they come here for those results. I think this practice has become the leader in breast reconstruction in the Valley, not by accident. We have a wonderful following in terms of referring general surgeons that send us and trust us with their patients for reconstruction, and we take that practice very seriously, and we're very proud to provide that service to the community. It is a privilege for me to be chosen to be your doctor. Really, the privilege is mine to be able to be the one that's involved in that patient's surgery decision and life-changing event. And at the end of the day, when we're looking at before and after pictures and that patient says thank you, thank you, thank you, that's the moment I'm striving for from the very beginning.
When you're told you have breast cancer, you want to see that deer in the headlight look, and all of a sudden it's find an oncologist. Who's your breast surgeon? What about your plastic surgeon? What? You mean I've got to go through and find all these different doctors? What? I came flat as a board, bald as a baby's butt, bald, and coming in and still, they give you a hug. I feel like the Masharafa brothers and their staff, it's like they're family and friends of mine. As painful and scary as sometimes what you feel like you're going through is, it's a very smooth transition. I'm so happy with the outcome. And I feel and I look better than I thought I could ever look. And 100% goes to the two brothers and the staff.
I was diagnosed with breast cancer and I was moving very quickly. I was not surprised by it, I was anticipating it. Got diagnosed, I had planned. I knew who my doctors were all going to be except for the reconstruction. That part had never occurred to me. It was like a step that if I was lucky enough to go through, it would be following immediately. I was very focused on what all my biopsies and outcomes and everything were going to be. But it became probably the most focused part of the next year for me. One of the biggest surprises I had was earlier this summer I was traveling out of Sky Harbor and go through the security checkpoint system. Something had targeted me, so they pulled me aside. And, a really nice TSA agent has me stand in front of her and hold my arms out, and she's not patting me down yet, and she just goes, implants. And I went, no. And she raises her eyebrow and she goes, no implants? I went, no. And I'm trying to think back because I'd had 11 surgeries and I'm going, my knees are all there, bladder lift, there's no implant there. And I go, yes, I do have implants. I had just never viewed them as that. The results of my surgery were so natural and the process was so easy for me. It never occurred to me that I had implants. It was a process. There were several surgeries to go through, and every single day that I came in for either a fill-up or a pre-op surgery appointment, every one of them brought me a step closer, and my excitement level to come every week, it made me look forward to seeing Dr. Masharafa. And the end result was just something that made me feel whole, made me feel like I could go out there and not have to think twice about how I looked in my clothes. And it was a very kind thing that Dr. Masharafa and all of his team did for me.
It's impossible to operate on a stranger. I think that if you have all the surgical skill in the world, but you don't have a desire to know your patients and understand what they want, what they're hoping to achieve, what their objectives are, what their goals are, what they see for their future, it's not your final assessment that is most important. It's theirs. Unless you can get inside their head and understand exactly what motivates them, why they're here in the first place, what their expectations are, you really can't provide the best quality outcome no matter how technically skilled you are. I've sat right here in this office and talked patients out of surgery because I didn't think it was a good idea. Either their motivations weren't right or they weren't good candidates. At first they're a little bit taken back by that and they say, well, you know, isn't this what you do? And at the end, almost invariably, they'll say thank you. You know, thank you for seeing me as a whole person and not just as another case on a Wednesday afternoon. That's how you build trust. I think you build trust by first and foremost showing patients that their health, their safety, and their well-being is your #1 priority. Beyond that, again, you have to execute the procedures with expertise, where they know that you've been properly trained, you're properly credentialed, and you're keeping up with the times. You know, this is an evolving world of plastic surgery. It's not a stagnant thing. If you're doing plastic surgery the way it was done 20 years ago, you're not doing it the best anymore. This place is about the people that are here, the people that work here, the people that are being taken care of here. The interpersonal, you know, interactions between all those people are really, really very unique. Everybody here shares in our vision, and that's the Moshe Rafah experience.